Rebecca McClellan worked as a paramedic for ambulatory services in England. But even with that medical background, she found it hard to receive mental health services. When she moved from A6 to Ipswich, she found herself without support and was ordered to change her medication. Days later, she took her life. When people need help, they call emergency services. But when first responders need help, who do they call? The question here is who protects first responders from the mental scars left behind? Today, I want to talk about a critical issue, where first responders are receiving insufficient assistance in matters related to their psychological well-being. The lack of mental health support is leading to a crisis of burnouts, threatening public safety, and leaving us vulnerable. In our status quo, these brave individuals who save lives are losing their own because they don't get the help that they deserve. This isn't just sad, it's unacceptable. 3 things in my speech. 1, the impact on public safety and burnout problems. 2, the importance of reciprocal care for first responders. And 3, possible solutions to government policies and healthcare infrastructures. 1, burnouts not only affect first responders, but also have consequences on the entire emergency response system. When first responders are mentally unstable and are not treated with proper treatment, it is very likely for them to leave their jobs. And already, there aren't enough people that are willing to take on these demanding roles. And the constant turnovers are worsening the situations. This becomes a cycle where one leaves due to stress, the remaining individuals get even more stress due to reduced numbers, hence increasing their chance of suffering burnouts as well. Imagine a community without any police officers. Imagine a community where there aren't enough firefighters or paramedics. Imagine a world where there is nobody to respond to 911 calls, patrol school zones, or secure your safety. The shortage of first responders means longer response times and delayed emergency care. Without them, your safety is not secured. For example, during the COVID-19 pandemic, the National Emergency Number Association reported increased call columns and decreased staffing, basically delaying the whole emergency response process. This is the reality. Due to burnouts, people are leaving their jobs and even taking their own lives. Not only do they deserve better, but for the safety of our entire community, we should take care of their mental health. Every major crisis, starting from natural disasters to pandemics, have first responders on the front line. Lack of mental health support for first responders has a profound impact on public health and safety. The impact of inadequate mental health support on public safety is more than you can imagine. 2, according to the Mental Health Service Administration, first responders are more likely to die by suicide than in the line of duty. First responders sacrifice their mental well-being for the sake of our safety. When they step into danger, whether it's rushing into a burning building or responding to a dangerous criminal, they do so with the understanding that their safety is secondary to ours. Those who protect us shouldn't be expected to shoulder these consequences by themselves. And as decent human beings, it is our moral duty, it is our moral obligation to provide them with proper mental health care. A study published in the Journal of Emergency Medical Services reports that 37% of EMTs and paramedics contemplated suicide, a rate nearly 10 times higher than the general population. We rely on first responders to be there in our most desperate moments. But if we don't take care of them, who else will? Who else will take care of the health of these individuals? And who else will take care of the health of us? We need to understand how first responders' state of mind is directly linked to the safety of our entire community. First responders are committing suicide and quitting their job due to burnouts, and without proper medical care, it impacts first responders and the entire community itself. Number 3. So what are some solutions? A. Implementing laws that mandate first responders to have routine health examinations. And through these examinations, professionals will aim to identify signs of burnout or other mental issues early, basically allowing immediate assistance. By making mental health checkups as part of their job, they're more likely to receive proper support. It will prevent burnouts from becoming chronic, reducing the likelihood of first responders to resign due to their health. B. Basically building specialized clinics for the first responders and providing easy access to regular health counseling and therapy sessions. Clinics will have mental health professionals available when needed and will be located near first responder facilities. It will provide first responders with immediate access to these mental health professionals. First responders' mental health is an urgent issue that has to be tackled immediately. We can develop specialized clinics and regular health checks to offer essential support for those who give their lives to ensure our safety. This is our vital step in ensuring the safety and well-being of our entire community, not only just the ethical duty. At last, it is our moral obligation to help them. Thank you.